Kenya is said to be one of the 30 TB-burdened countries in the world, and recently there has been a significant concern on the rise of TB infections among children.
It is caused by a bacteria that is airborne, so it can be very easily transmitted from one person to another, either when the person who's infected coughs or sneezes or sings or even talks.
1-year-old John Mwangi, not his real name, is one in thousands of children diagnosed with tuberculosis every year.
After kukaa 1 week mtoto alianza kugojeka, tunaenda clinic, tunaenda hosi. Mtoto anatibiwa lakini haponi, anakaa 1 week anagojeka, anakaa 1 week anagojeka. Alafu mara ya mwisho kuenda daktari akasema hawezi tibu mtoto juu hajui ni shida gani, asikuwa na kunywa dawa zenye si za ugonjwa wake. Kutoka hapo tukapewa lifalo, tukaenda Maragwa, mtoto akapigwa picha. Sasa hapo ndo alianza matibabu yake. Hadi wa saa hizi mtoto ameishi kukunywa dawa za TB.
According to Dr. Florence Njenga Washira, even though there are about 5,000 to 6,000 children diagnosed with TB every year in the country, there is a concern of the disease being undiagnosed among children, with 15% of all TB cases accounting for children.
You get a lot more of them getting progression to the disease rather than just having it as a quiet infection in the body. The other large number of children who get TB is the children who are between 10 and 14 years. That's the adolescents, which may be more due to their social habits rather than their immune system.
Dr. Florence also tells us that unlike in adults who are affected by TB way later after contracting the virus, children bear the effects of TB immediately.
If a child gets TB disease, they also have a higher risk of getting the complicated tuberculosis. That's TB meningitis, TB that spreads through the blood, what we call disseminated TB, and even TB in the bone and other forms of TB. While in adults, you're more likely to have just pulmonary TB with very few instances of complication.
Even though the signs of TB are the same in children as they are in adults, such as coughing, fever, weight loss or night sweats, there are those that a parent should look out for, such as the normal growth of a child, which many overlook.
But the weight loss may present more like a child who's not growing as well as they should, rather than actual visible weight loss. So what we call failure to thrive. That child is just not progressing as they should. Then you may find that they are lethargic, they're not playing as much, they're irritable, crying a lot, and they may not be able to verbalize the exact symptoms that they're feeling.
To this end, experts are coming up with interventions to help fight TB in children, such as use of child-friendly tuberculosis medicine.
Kazi imekuwa ngumu kufanya kazi ukiwa na mtoto mwenye ako na TB, huwezi acha mtoto. So hakuna kazi ningefanya, nimeishi tu kushughulikia mtoto.
Just like in many other households with patients, parents taking care of children with TB have their fair share of challenges.
Tumemaliza clinic sasa. Amepona. Ni ugonjwa kama ugonjwa zingine na huponwa. Si vizuri kutegana na mwenye ako na TB juu unaweza jikinga, unaweza jikinga na usipate TB. Hata mkiwa na mtu mwenye ako nayo si lazima ukue mgonjwa wewe.
However, TB is curable with early diagnosis to give one a chance to a healthy life. Robbie Omondi, K24 Health Beat.